This is a reaction video to more best ever food review show, $3,000 Thai hair transplant. Was this a mistake? Let's check it out.
In this video,
this is where my new hair is going to be.
That drill sound was kind of scary. It usually doesn't sound like that.
I'm going to be talking about why I got a hair transplant and how hair transplants work.
It's a never-ending process.
Yeah, I mean, it does take most of the day, and some patients are surprised by that.
I know what you guys are thinking. Sonny, you did not need a hair transplant. You're beautiful the way you are. Your hair was...
Man, he's got the A-kind hairline in this frame.
Even if you go back to 10, 12 years ago, I always had a bit of a widow's peak right here. And then...
So this is not a widow's peak. The widow's peak is that little central area right at the center of the hairline. Yeah, so he's maybe like a Norwood 2, something like that. Nothing too major, but you can see that frontotemporal recession that he has.
I was starting to hate the way it looked on camera because I wear a bandana because a bandana's cool.
Okay, so I guess he usually wears a bandana, so that even takes more attention away from the hair, but it was still bothering him.
A friend who has been on this show, who I will not reveal, told me that he had gotten a hair transplant in Thailand. And he said it was pretty cheap, actually. The place I went, it cost $3,000. $3,000.
Yeah, you know, some patients will go to Turkey, other patients will go to Thailand, you know, others choose to stay in the States or Canada, Europe. You know, there's lots of places you can go to get a hair transplant, but you always have to do your research to make sure that you're going to a reputable place that's going to take good care of you.
Procedure that lasts a lifetime. I can't believe it. This is something I never would have researched for myself, but since my friend did it and he had good results, I thought, you know what, I'm going to Thailand. All those videos I made in Thailand for the second channel, that was right before the surgery. So before I get to the procedure, the answer as to why I wanted to get a hair transplant is because I just wanted to look better on camera. Anytime somebody gets work done on themselves, it can be kind of controversial. There's a line somewhere, right? Some things seem understandable, like braces, which I've had in the past, and then some things seem a bit too far. We all know those people, when you see them, they've gone too far. I didn't think having a hair transplant was nothing, but it didn't seem like a crazy life-altering surgery that I couldn't come back from. That was until the day of the surgery when I freaked out.
Well, remember, there are real risks to hair transplant surgery. It's a long surgery. There's a lot of lidocaine that's used throughout the day. And if the surgical team isn't careful with the quantities of lidocaine, you could potentially experience some toxicity levels. I just want to remind you that we have a weekly newsletter that talks about hair loss and offers information on hair restoration. Be sure to subscribe to it at hairlinesnews.com.
Alright, so this is the last time you're going to see me as a semi-balding 37-year-old. After this, I don't know, but I'm hoping for the best. I'm a little bit nervous. Right now, I'm about to step into a surgery.
Well, remember, a hair transplant, especially a single hair transplant, is not going to prevent further balding. It's not going to be the end-all be-all if you were to lose the rest of the hair in the DHT sensitive area. You might need more hair transplants down the road to maintain that look, to augment that look, because you don't know exactly what will happen to the rest of your hair.
I'm mostly scared because it's an 8-hour surgery and they've just blindfolded you for 8 hours.
So what I'm seeing here is they're using the Choi pens, and this is essentially like DHI, which we have a video on, FUE versus DHI. Watch that because some of that terminology can be confusing and misleading. But these pens essentially have the graft within them, and it's a little click of a button that gets the graft into the scalp at the recipient area. So the grafts are first harvested from the back, and then they're loaded into these pens, and they're like locked then into the scalp.
Just sit there. Ugh.
We don't cover people's eyes. We don't blindfold them. So some patients get anxious about having a covering over their eyes. So typically for most classic hair transplants that are scalp-based, we don't cover the eyes. If we're working on the eyebrows, we'll typically put some moist gauze over the eyes just for safety purposes.
The only way I picked the clinic I went to is because it's where my friend went to. Right before the surgery, I asked them if I could shoot some behind the scenes clips so I could show people later. To my surprise, they said yes.
And word of mouth is huge. A lot of patients who come to us also, present because they were referred by a friend who was happy with their results.
And I want to make it clear, they did not pay me to make this video. I'm making this video because I think it is an interesting procedure, and if I was one of you guys, I would think, hey, how the hell does a hair transplant work? Well, here's how. So before you get the procedure, you sit down with the doctor and they tell you a bunch of things that you maybe should.
We have like a few hundred videos on how it works, so let's see his take on it. Make sure to subscribe to the channel and turn on all notifications.
Procedure, you sit down with the doctor and they tell you a bunch of things that you maybe should have researched before that moment, which I...
So remember, some clinics don't even let you sit with a doctor. You'll sit with their consultant. And this is a sales professional who knows some of the basics about hair transplant surgery, but is not a doctor. They're just trying to give you the sales pitch on what you might want to know, but also trying to lure you into the practice.
First they said there are a bunch of things that can go wrong. Your head can reject the hairs. You can have this hair shock syndrome where a bunch of your hair falls out. And the weirdest thing is because they are transplanting your hair, if you don't take the special pills, you could end up keeping the hair in front that they transplanted and losing the rest of the hair behind.
He's talking about medical therapy. So it seems like they've covered the risks of the surgery and also given him some education about the importance of medical therapy, finasteride, minoxidil. And that's important for overall, impact of an appearance of his hair.
Behind it, looking like a complete psychopath. What throws people off is that after a few weeks, most of the hair they transplanted falls out. Oh yes, this is a long-term commitment. They told me your hair is going to be looking good and ideal in 12 to 18.
Essentially at the 3 to 6 week window is when the hair that was placed falls out. New hair comes in at least 3 to 4 months later.
The next thing they do is they draw where your hairline should be.
It's important when doing hairline work to create micro and macro irregularity. That's what gives the hair a more natural appearance.
The procedure includes looking at 3 interns and them saying, maybe the right side should be higher or lower. And then they look at you and they say, what do you think? And I go, you guys should be good at this. I don't.
Yeah, we have the same conversation, and some patients are very confident when it comes to adjusting the hairline drawing before we start in terms of the markings. And other patients are like, I have no idea. I think it looks okay.
So first they take a little tool and they start punching little holes in your scalp.
All right, the first step is complete. The whole top of my head is numb. I'm a little bit woozy because they gave me a value.
So when he's saying hole punching, he's talking about the recipient sites. And so in this clinic in particular, they made the recipient sites first, which I think is actually very valid when you do hairline work. And we do that actually fairly often, making the sites first so that you know exactly how many grafts you need when you go to the back.
Step 2 is extraction. So step 1 was putting all these little holes in my head. Well, now we need to fill those holes.
And again, remember that it's okay for the extractions to be step 1 and for the recipient site making to be step 2. It depends on the clinic, it depends on the patient.
Something that is hairs on the other side and back of my head. So they've extracted.
So the little holes that were made in the back, that is the FUE technique, right? The alternative to getting the hair out would be a strip, which is called FUT, and we have a video, FUE versus FUT, so watch that. As far as pros and cons, it's not that FUE is always better. It's not always better.
The way your head and skin looks right after the transplant is completely terrifying. That apparently is completely normal.
All right, so it's been roughly 11.
Yeah, I mean, it's gonna look sort of bloody and swollen and, not great immediately after. It's funny because on the surgeon side, we're always like, oh wow, that looks great, because, we're looking at the overall pattern and the density. The patients, they're like, oh, that doesn't necessarily look like what I wanted.
They're going to, as they put it, teach me to wash my hair. Hopefully, they're happy with this healing. I didn't bleed a bunch or anything like that. It just looks kind of crusty and my hair looks greasy. And I look like I want to be sushi chef or something. And I have the diaper on the back of my head. So they're going to take that off. Before I go out, I had to put on my bonnet. This is to protect from dust and from sun or anything like that. So I'm going to be wearing this for the next 2 weeks. Anytime I go outside, it's kind of cool. Thank God I'm married already. Otherwise, virgin for life.
So it's good how carefully he applied that cap or that bonnet. It almost looks like a surgeon's cap. But very important not to rub against the grafts, and he did a good job of that.
Bro, how cool do I look? So fresh, huh? When you go to the clinic, they take even more pictures, and then they try to teach you how to wash your hair, because you cannot just... You have to pour a warm cup of water over your head and then pat it dry ever so slowly. Now, they would prefer if you could stay in Thailand for a week to recover, but I had to fly later that day.
I'm usually fine with patients flying out as early as the following day or the day after their procedure, you know, we stay in close touch with them, and we have very specific instructions on how to wash the head and what to do with it.
Looking slightly better, although you can see I got a little bubbly head here, huh? Still pretty swollen, but a lot of the redness.
Yeah, the swelling will descend down over the first week, and then it basically dissipates.
The healing process took some time. They said no drinking, no exercise for 2 months. That's literally all that brings.
Yeah, you know, I've heard that from other clinics as well. I don't restrict my patients to that degree. I usually say to avoid exercise for about 2 to 3 weeks. You know, after that, it's going to be difficult to really disrupt the hair. And as far as alcohol goes, usually it's just the first 3-4 days, because the only thing that alcohol is going to do is to thin the blood. Restricting alcohol for 2 months, and I don't see the advantage of that. And then restricting exercise for 2 months, I also don't see the advantage of that. And there's no data to say that that's so critical.
A couple months later, we went to Indonesia. Here, I finally felt comfortable wearing the bandana again, but you can see a lot of the hair has fallen out, and it looks pretty terrible. I think it maybe even looks worse than before.
The reason it can look worse after the hair that's transplanted falls out is because you now have some small degree usually of shock loss, right? So it's thinner. And also some of the hair actually gets just cut as you're making all these different sites. And so it's just going to look a little bit thinner than when you started, and that's normal until the new hair comes in.
Before I got the transplant, if you look at some of the scenes in Indonesia, I just have these big empty spots where there's no hair. After that, we did Sri Lanka. Still pretty poor. After that, over the next few weeks, it started to heal and just little hairs would begin to sprout and grow until now it's finally become thick.
It has been about 4 months since my hair transplant, and I must say I am blown away. I mean, there was all nothing here before, and now it's all my hair. It blends in pretty perfectly, and then now when I wear the bandana.
And 4 months is still an early result, so that's good.
So if you were curious about how hair transplants work, that's how it worked. If you want to get one, do it. If you don't. It's not a commercial.
Yeah, that's basically what we try to do with our channel, is to educate people on the pros and cons of hair transplant surgery. Well, I'm really happy when folks decide to share their stories, whether it's on YouTube or elsewhere. Props to him for going through this and for sharing the experience with the rest of us. We also did a reaction video to Brett Maverick's hair transplant, so make sure to check out that video here.